welcome. I'm Ritu Bhandari, and you're watching Mindmine Mondays, our special conversation series where we talk to thought leaders from diverse fields to discuss innovative ideas and emerging realities that will shape our future. Today, we are bringing a very special episode to you. We are calling it Courage Under Fire, Stories from the Pandemic Frontlines. The COVID-19 global healthcare emergency is one of the biggest humanitarian crises that we've seen in recent times. And it's a crisis that has brought people together from all walks of life, whether it's governments, healthcare fraternities, celebrities, NGOs, business leaders, or common citizens like you and me. Everyone has been trying to make a difference. So we're going to spend the next 1 hour in trying to bring you some of these heartwarming tales from the pandemic frontlines. And as always, this conversation has been curated by the Mindmine Institute, an independent think tank by Hero Enterprise. So let me welcome my first guest on the show today, also my co-moderator for this session, Sunil Kant Munjal, Chairman of Hero Enterprise. Mr. Munjal, thank you very much for joining us here today. Stories from the pandemic frontlines. I'm looking forward to this session. How about you? Who do we have on the panel today?
Thank you, Mridu. Thank you for doing this. And we know there is a lot of negativity going around right now due to the crisis that has been created worldwide. It is a pandemic, that's why it is worldwide. And we do know that both on the health front, economic front, on the social front, we have seen many, many challenges, and all the newspapers, TV, and media are full of that. We thought it would be a good idea today to also look at the human spirit, how it shines in such difficult and challenging circumstances. We have examples of Shanti Chauhan in Mumbai, who's feeding hundreds of migrant workers where she can hardly afford to feed her own family. Sonu Sood, the film star, has been organizing buses and trains and tickets for migrants to get back. We have a 15-year-old Jyoti who decided to carry her injured father on a bicycle for 1,200 kilometers to take him back home. So there are just hundreds and hundreds of stories, and these are not just in India, we are hearing of these worldwide. So we thought we should get people who are actually doing this firsthand to the visitors and the viewers on this show to see what truly human enterprise is all about. Ideally, we would have liked to get a nurse, a ward boy from a hospital, somebody delivering packages to us in our homes, someone selling vegetables, because reality today is we are understanding a whole new concept of patriotism. The concept of serving humanity is the new patriotism. So, but we did, unfortunately, we cannot get all of them on this panel. We did get leaders from these walks of life. So let me start in the order in which I can see them. We first have Dr. Naresh Trehan. There are expert doctors and there are outstanding administrators. It is rare to see an individual who marries these two together in one person and does an outstanding job, not only running an institution, but also on guiding, advising lots and lots of policymakers, governments on what to do and how to get through this difficult time of this pandemic and the many myriad challenges that it's thrown up. We also have Justice Arjan Sikri, a much decorated former Justice of the Supreme Court of India. He was also called, by the way, a professor because of his intellectual inclination. He is a highly decorated and recognized justice who's worked on arbitration, worked on all kinds of legal issues, including some path-breaking judicial issues. We have with us Manjinder Singh Sirsa. He is the head of the Delhi Gurdwara Prabandhak Committee. And we have with us the head of the police of Punjab, Dinkar Gupta, again, a much decorated officer, one of the only ones, I'm told, from North India, recently empaneled to take on a DG position at the center level as well. Let me just go back for one moment to Mr. Sirsa. He and his organization are doing an absolutely amazing job today. The Gurdwaras, like all religious places, are closed, but they are feeding lakhs of individuals, migrants, homeless, every morning, every evening, to trying to make sure they don't starve. They are serving them, they are cajoling them, they are advising them, they are counseling them and guiding them. So each one of these represents a part of our society which is truly doing something outstanding. So it would be useful to hear where the bright sparks in today's dark clouds are. Back to you, Mridu.
Right. Thank you very much, Mr. Munjal, and welcome, gentlemen. It's a pleasure to have you here with us exclusively on CNBC TV 18 television and digital platforms. Dr. Trehan, let me begin with you. You've been at the battlefront lines for a few months now. As far as COVID-19 is concerned, the numbers have, of course, become very worrying for India, even as we have begun unlocking the country in phases. At Medanta, what is the status of COVID-19 capacities being used at the moment? And how have you ensured that non-COVID patients also have access to healthcare and medical advice at this time while staying safe? Dr. Trehan, if I may request you to unmute your mic, please.
Unmute, please.
Yeah, okay. So all that is happening today, like you mentioned, the increment in the number of cases exponentially, that's all was expected at this stage. And that's why I always said the lockdown helped us to create enough facilities so that when it starts speaking or spiking, it will be that we will have at least enough beds, ventilators, PPEs, all that stuff that it is required to cope with this pandemic. And that has happened by and large. But what has happened is that there are two outliers right now. And there is Mumbai and now it's Delhi, that we are fast running out of resources in these two hotspots. But I have always said from the beginning that we should not think of one city or one area alone. Like you saw in New York got overrun. And we have now same situation here, but New York had New Jersey and Connecticut to help, and we have Gurgaon and Noida to help Delhi. So I think that we'll be able to cope with it. It's going up, but we just need to coordinate our efforts a little better.
Right.
And how to take care of non-COVID patients. We have created separate COVID hospitals, and also the hospitals that have two separate blocks can easily take care of COVID patients without mixing up with non-COVID patients, so they can be taken care of safely.
Right. And DGP Gupta, you and your force have also been at the front lines in a different manner, front lines of this pandemic, along with our medical fraternity. The first phase of unlocking India has begun today. How was day one on ground level as far as law and order is concerned, and how are you gearing up for the next couple of weeks?
Unmute.
Can you unmute yourself, please?
Yeah, sorry about that. Punjab was the only state where our chief minister, he ordered a complete curfew actually on the 23rd of March, and we were 56 days into curfew. And so it was a huge challenge, but it kind of helped. And now as we unlock, this gradual unlocking has been going on for some time. And today, we are happily placed. As of now, things are under control. But then, as Dr. Trehan mentioned, with the unlocking, we have seen an increase in cases. But in terms of medical facilities, et cetera, we are quite well placed. Our forces are, they've been on the front line for all over like 2 months. But they are doing all right. And we are gearing up for this opening with the malls and the opening up, the religious places opening up. And we do expect an increase, but then, it has given us a breather to build capacity in various ways.
Right. And Mr. Sirsa, when it comes to tough times, the Sikh community is always amongst the first to help out, stand up there and go out there on the front lines. Give us a sense of all that has been happening in terms of feeding the underprivileged, especially migrant workers. What is the reach of the Gurdwaras under you been like on a daily basis, particularly as far as the underprivileged community is concerned?
See, I think not in just my lifetime, but the people who have been working in this institution from last 30, 40 years, as per their experience also, this is the first time that such a long service has been provided by the Gurdwara Management Committee. We are providing almost 200,000 of meals every day to the people who are not just unprivileged, but those who are actually striving with hunger. If you speak to them, if you talk to them, you'll start crying. And this is a marathon job. I must say this was a biggest challenge for me also. I've been a general secretary of this organization for 6 years. I'm a president from last 1.5 years. But that is a biggest ever challenge I have faced in my entire life when I see thousands and thousands of people crying, starving for hunger, and they need a food. But it was a big job, and hats off to my Delhi Sikh Gurudwara Management Committee staff, the all sevadars, the people who cook food, is called as a langris, maybe it a kirtaniya or ragi. Everybody has come out in a big scale and contributed towards these services. And that's the reason today we are able to achieve that. And every day we got a truck loads of food. The people come out here and contribute towards the Gurdwara, and truck loads of food is cooked food is being given to the people across the Delhi, not just across the Delhi, but up to Gurgaon and Noida also.
Right, right. And I'm going to come into the specifics of this mammoth task that you and your workers have undertaken. But let me also bring in opening comments from Justice Sikri. Justice Sikri, it's also been a time when the judiciary has been rather busy. The Supreme Court has had to intervene on a number of cases, and some, of course, have been proactive interventions, taking up issues related to migrant workers, state border controls, healthcare-related issues, etc. Would you say that the judiciary has been forced to intervene on many of these subjects because the executive at a lot of times was somewhat weak in clarifying the intent as well as implementing the ideas?
Before that, let me actually, because the other three speakers have spoken about in their respective fields, what contribution they are making, and it is an outstanding contribution, there's no doubt about it. But your question which you have put pertains to the judicial side. On judicial side, what the judges do or Supreme Court has been doing. Right. But I want to tell one thing here, which normally commoners or people may not be knowing. And I'll first supplement to what the others have said and then come to your question.
Sure.
I tell you, we have Legal Services Authority, which was constituted under the Legal Services Authority Act passed in 1986. The primary purpose of this Legal Services Authority is to provide legal aid to those who are indigent persons and those who are poverty-stricken or those who are marginalized, women, etc. But generally, it is perceived as if it is the function which is confined to providing legal aid or coming to the courts. But let me tell you what this Legal Services Authority is doing an outstanding job insofar as the COVID-related things are concerned. This legal assistance is required at various stages, like Supreme Court passed the order in the very beginning itself that in COVID conditions, there should not be overcrowding of the jails. And those persons who are under trials and have spent up to a particular period in jail, they should be released on bail. Now, most of them are the poor people. They may not be having their sureties, etc. So Legal Services Authority has done a tremendous job throughout the country, and particularly in Delhi, I know, in order to ensure that they are released. Then, insofar as the distribution of rations, etc. is concerned, the volunteers from Legal Services Authorities are going there. They are having their help desks. They are helping the migrant workers insofar as their registration is concerned. They are helping the people who want to travel and for their getting their e-passes, etc. So this kind of legal aid is also provided. So it is in a way support system, and even in the distribution of rations. And the reports which are released by the executive chairman of the NALSA, this is called National Legal Services Authority, who is the senior most judge of the Supreme Court. And if you go through that report, it shows an outstanding work which is done by the Legal Services Authority to support the, persons like Dr. Tehan, the persons like Gurdwara Prabandhak Committee and the police, etc. So this is one part. Now I'm coming to the second part which you have said about it. Let me say it in at two levels, but in a very short, I will not be expanding it because of paucity of time.
Sure.
See, your question was when the executive fails. But before that, I may add one thing. Irrespective of the function of executive, the judicial function itself commands that the judiciary has to step in such circumstances. We have in our constitution chapter 3, which relates to fundamental rights. We have in our constitution Chapter 4, which talks of directive principles of state policy, which are the policy towards the governance, better governance. And Article 38 of the Constitution specifically cast a duty on the state to provide social services, etc., of this nature, when you have talked in the context of migrant labor. Now, Article 21 of the Constitution has been read, which says the right to life and liberty, but it is given such a wide interpretation, saying that right to life and liberty does not mean a right to life of an animal existence. It means right to live life with dignity. And when we talk of this dignity in the context of migrant labor itself, then the identity of these persons and the dignity of these persons cannot be sacrificed. So it becomes a fundamental right. So judiciary should step in for such cases in any case. This is what I'll say. But at the same time, you are very right. When the executive fails in its duty, because the directive principles of state policy, as I've said in the Constitution, is the first and foremost duty in these things is that of the government, of the executive. When that fails, the onus is more on the judiciary to take care of these issues, because ultimately aim is to do social justice, which is ingrained in our Constitution. So justice is not only political and economic, but it is social as well.
Absolutely.
Why I say
Absolutely well said, sir.
Right.
And
So let me come in here, Mridu.
Yeah.
Let me come in here. One, just to comment that we had one more panelist who actually had to drop out. Nobel Peace Laureate Kailash Satyarthi was also supposed to be here, as we had also advertised. But partially due to the change in time that we made from 6 o'clock to 5 o'clock, and partially because of an exigency he had of his own, he had to drop off, and we will miss him, because he and his organization and many others like him are also doing a wonderful job, because one of the outcomes of staying at home for so long has been abuse at home. Both spousal abuse, abuse of minors has become a big issue. And this is an area in which, as you know, he does a lot of work. And he was sharing with me last week how much work is actually going on and how much these incidents have gone up, where both the police and the judiciary have actually stepped in and been very, very supportive. But let me ask Dr. Trehan. Dr. Trehan, how do you see the families of the patients who are afflicted? How are you seeing the families' behavior change in this disease as in any other disease when you see patients come into the hospital?
So, Sunil, there are multiple facets of this problem. Because one, there is a dread in everybody that if I get sick, will I survive or not survive? Because knowing that, okay, mortality is not that high, but this is more dreading than the flu that we get or anything else, because it's affected the whole world and brought it down on his knees. So then, first, your own self-survival. Second is your worry about your family, whether they will get infected from you, whether they will be, if something happens to you, will they survive economically? So all these things put together, and having come through 2 months of lockdown, lost your business, economically you're actually teetering on disaster anyway, this has placed a huge burden. And we have seen people behave, in depression, people have committed suicide, people have actually broken down or started sort of blaming each other. There are many, many aberrations in the behavior pattern that's happening today, and these are all cumulative from the facts that I just told you. So we have a helpline for helping people who do get mentally too oppressed. And the point basically is right now, and that is one of the reasons which people keep debating about, is it time to unlock, not to unlock? It is time that we have to unlock. There should be no debate on it. The other thing is, there's no point in saying we will do it in a way people can go out carelessly. We don't need to use the word we have to live with it, because people are misunderstanding that we have to live with the virus. They think now that you have to live with it, you can be co-opting and you can go without mask. No, you have to learn to cope with the virus. The coping with the virus is that your behavior pattern, as we have been described ad nauseum, must change for long periods of time till we get rid of this. Till either we will achieve a herd immunity, as they call it, but that's going to take a long time. But hopefully, there are some positive signs from vaccines. So hopefully this will still be limited to 6 to 8 months now, but we cannot take any liberties because this can play havoc on you.
Right, and just to add to what Mr. Munjal was saying, Dr. Trehan, you just spoke to us about patients and their families. I also want you to give us a glimpse of what doctors, nurses, and paramedics in the COVID-19 ward go through on a daily basis. They're also leaving behind families who are worried every day. What goes through their mind at the end of the day? What is the level of stress that they are under while treating some of these patients?
So it is a double whammy, but so what I just told you about, and then the front line that we have to actually fight at. And unfortunately, it's an invisible enemy, so you don't even know where it is. So there are anxieties in doctors and all that, definitely the same way as any human being will feel. But at the same time, the overarching responsibility of your Hippocratic oath that you are the one who will take care of people when they're in trouble. So I see by and large, the doctors are responding very, very well, knowing very well that a large number of them may get sick, they may get the infection, but they are standing there. We find nurses, technicians, housekeepers, the whole army. They are actually standing out. Now, it becomes even more of a responsibility for us as administrators, as doctors, as surgeons, to say how to cheer the front line and how to keep them safe. Right. So these are the obsessions we have right now. In the sense.
Those are some very, very good obsessions to have right now.
There are no two choices here. People will need us. They will need us more and more and more. Yeah. And it will be like desertion, from an army if we start running away. Because I'm of the age where I'm in that vulnerable group and I come to work almost every day. And everybody worries about me. But I said, look, if we run away, there's no hope. So we are here standing in the front line with our troops. And hopefully we will be able to see an end to it. That's our aim.
If I add to what Dr. Trehan has said, my own nephew and niece, they are doctors and in government hospitals. And they say to me, many times they have said, and he's there almost 24 hours, but comes back for a few hours at home. He says, I'm not worried. I'm there because I'm a young man. I'm taking care of that. And he tells us the stories, that horrifying stories of the people who are taking treatment and who are dying also. But as you rightly pointed out, he says that I'm worried about my family. When I come back, because I'm exposed, that I have to maintain distance from them, that they should not come near me. And so these kinds of dichotomies and these kinds of, problems are there. Very correct.
Right, absolutely.
So that was the very idea actually of today's session, is to look at what an amazing job these people are doing with a clear and present danger and threat to themselves. They are putting themselves at risk, but going out and doing this service for humanity and other people, whether they're patients or otherwise. So on that, may I ask the DGP Punjab, now clearly while you're DGP Punjab, but police across the country has seen a very strange situation where you had to tell people, stay home, don't come out of your home, don't go for a walk, don't go to the park. And this is in some sense almost inhuman, but we know you're doing it for the people's good. Now, how has this impacted the general law and order situation by people staying home? Did you see less crime otherwise? And when it's opening up, are you seeing that spurting, or are you seeing the spirit of humanity also out there, both in Punjab and otherwise?
Right, and also perhaps add to that the impact of joblessness and the economy going into recession, loss of jobs happening. Is there an impact on the crime rate as of now?
Yeah, let me start by saying that the executive, whether it's a civil administration or it's the police, all across the country, we have over 700 districts all over the country. I think every district magistrate, every police chief of a district, that's our steel frame. And they've risen to the occasion. In fact, I was talking to a classmate of mine, the cardiologist in the US, and he said in the US, they are feeling the need for a bureaucracy. In this city where he was, he said they're just public health professionals, the staff there. So people, officers have risen to, they have gone beyond the they have risen given to the.
I think we are having a technical difficulty in connecting to the
provided support and of great unseen of various kinds. And so the executive, Mridul spoke about the failure of the executive. Let me say that the executive has equated itself very well. They have risen to the occasion. They have done everything possible. People have, working 18 hours, 20 hours at different levels. I had to tell my SSPs to send the the heads of the police stations, the SHOs on kind of like forced leave, because, we had a curfew across the state. I mean, we talk about a curfew in a mohalla, in a district, in a communal situation. But here you had, as Sunil said, that you had to have people make them sit at home, and which is like inhuman, which is difficult. It causes huge inconvenience. There were pregnant women wanting to go to hospital, old people, turning senile. They're not able to go out. They're not getting enough sunlight, mental health issues for people. In fact, we started a helpline even for our cops, actually, because, they were, their families were, having 48,000 Punjab police cops out on the roads and the streets, braving the infection. When it started, there was a huge uncertainty in everyone that this is like, you will just go out and catch the infection. There is no, and so it was a huge, this thing. So people have risen to the occasion, and I think they've given a lot of support. The police force in Punjab alone, we have provided over 7 crore meals to the poor, to the underprivileged, to over 10 lakh migrant laborers, and that's the level of this thing. And policemen have done it of their own, actually. They've done it, they have contributed money, they have turned their homes into langars, actually. I have had a head constable, a lady head constable in Amritsar. Sunil spoke about humanitarian stories, and so she turned her house, it was in the police lines in Amritsar, into a langar, and there was a team of about 10, 12 police officers, both male and female, led by an SP rank officer. And they started this langar of their own. They were serving 4,000 to 5,000 people every day, and they did this for about 50 days.
Wonderful. Wonderful. Those are some very, very heartwarming tales that you've just shared with us, Mr. Gupta, and I'm going to come back to you in just a bit. Let me also go to Mr. Sirsa at this point. Feeding lakhs of people every day also means that hundreds of people of yours, your volunteers, are engaged in preparation, in distribution of food. How are the volunteers then keeping themselves safe while helping others? What are the checks and balances you're putting in place for that?
Can you also share with us, Manjinderji, some of the more endearing or the more emotional stories that you have to share of the experiences that you have seen of on the one hand, the suffering of people, and two, the support and the courage of people who are providing the support?
Right.
Sunilji, I've got stories where I can write, say, a book with thousands and thousands of pages, because what I have seen in this last 70 or 75 days, I don't think that, in fact, I would have seen in my entire life the pain, the agony, and also the courage. So definitely when you are into it, it gives you a courage also, it gives you a strength also. But let me start with one thing first. So the day we started, because as usual, we have been serving the people, thousand people comes to Gurdwara, and we have served them with a langar. It's not anything new for us. But the situation turned to a different level when government started approaching. Other day, one SGM calls, another day, another DC calls, another day, another DC calls. And now there's pile of papers saying, ki hame itna khana chahiye, hame itna khana chahiye. And we started in roping our people, our volunteers, which we call langaris and other sevadars. Now, the biggest challenge was that if this langaris or sevadars will go to their home, then there is very chances that they may get infected or their family may get infected. So when I asked them, so you want to volunteer and live over here? They said, yes. हाँ सी ऐसे ही रवांगे, हम यहीं खाना बनाएंगे, यहीं सोएंगे, और वैसे भी हम ये चाहते हैं कि घर जाके टाइम आने जाने में वेस्ट होगा, तो मे बी इसके दौरान अगर हम 1000-2000 लोगों के लिए और खाना बना सकें. And you will be shocked and surprised to know that Bangla Sahib itself had arranged a meal of more than 100,000 people every day, morning and evening. And those people start their day from 4 a.m. in the morning. There were instances, jab somebody got hurt by some kind of a machine. We got a big machines there. We have to order new machines. We dropped in 3 new machines for a chapati making machines, and asked that sevadar ki tu jaake aaram kar la. He said ki nahi. He said okay. And by the way, afternoon when I came back, I saw him again working on that same machine. I said, "ਤੂੰ ਇੱਥੇ ਕੀ ਕਰਦਾ ਪਿਆ?" ਕਹਿੰਦਾ ਜੀ ਉਹ ਕਹਿ ਰਹੇ ਸੀ ਜੀ 2000 ਪ੍ਰਸ਼ਾਦੇ ਹੋਰ ਚਾਹੀਦੇ ਨੇ। ਮੈਂ ਸੋਚਿਆ ਜੀ ਕੋਈ ਵਿਚਾਰਾ ਰੋਂਦਾ ਹੋਊਗਾ, ਅਸੀਂ ਬੜੀ ਭੁੱਖ ਦੇਖੀ ਆ ਤੇ ਮੈਂ ਕਿਸੇ ਨੂੰ ਭੁੱਖਿਆ ਨਹੀਂ ਦੇਖ ਸਕਦਾ। I've seen that strength in my people. Can you believe in last 75 days, there are more than 500 people working day and night, cooking food, delivering food, drivers, porters, but by the grace of God, by the blessings of those people who got the food from them, nobody got sick in last 75 days. That's a miracle, I must say. That's a real miracle, I must say, first of all. Secondly, when it comes to the people, in my entire life, because people come and donate in Gurdwara, you do not know who is donating what. But in this time, we have no golak at all. Nobody was coming to Gurdwara, and we have no funds at all, because all Gurdwaras run through the people who donate as a daswan to the Gurdwara. I've seen people coming out, I don't know, from nowhere, coming with the truckloads of food, and not just Sikhs. Sunilji, you'll be really surprised to know that there are people who do not know about the Sikhism. The people with a surname from South India or from east of India, or maybe from Madhya Pradesh or from Odisha, or some from West Bengal. I was shocked when I got calls from them कि हमने जी सामान भेजना है, कहाँ कैसे भेजें? People send trucks of food from Madhya Pradesh, Katni. There are people who send a food and said हमारा कहीं पता नहीं चलना चाहिए. हमने कहा who sent this food? Who sent this packet? इसके जो उन्होंने कहा नाम नहीं बताना, बस आप छोड़ आओ. So what I find out in all these days is the people are not just worried about COVID-19. They're not worried about coronavirus. They are more worried about their hunger. And I've seen a people crying like anything. A few days back, I was going to Gurdwara Rakabganj in the afternoon. As usual, I saw around 60, 17 laborers walking barefoot, and that too in a sunny day. I called them. I said, the moment I rolled my window down, they ran towards me. Sir ji, हमें खाना चाहिए, हमें खाना चाहिए. I said, आप जा कहाँ रहे हैं? मध्य प्रदेश. मध्य प्रदेश पैदल? जी क्या करें? कहाँ से आ रहे हैं आप? हरियाणा से. There were small children. They were crying like anything. Pani, you know, the water they were carrying in there, इतना गंदा पानी. I said, पानी कह रहे हो, मेरे को पानी भी नहीं देता. लोग डरते हैं. लोग कहते हैं कोरोना हो जाएगा, घर से नहीं कोई निकलते. मैं उनको बस में लेकर रकाबगंज आया. Sunil ji, I've seen that 5 years old child asking my सेवादार और खाना डालो, और खाना डालो. And then अपनी बेली पे हाथ मारता है और उसने 4-5 another प्रसादा and वो अपने पास अंदर अपनी डाल देता है और अपनी माँ को तरफ देख रहा है. And he's trying to tell him that mother, I won't ask you from this. I've got enough with me. And there was a lady who just got child of 12 days child, and she was walking from last 2 days without any food. I'm really, when I see all these things, I say there is lot more than corona. The real pain is there, what we have seen today. And I think that have changed the perception of entire humanity, entire system. And it is not finished. Munjalji, because you are a big businessman, you must be aware of this. It is just the starting of this crisis. It is just started of this crisis. And from, I must say, from now onwards, from the month June onwards, it will travel like anything, because people have no resources to eat. Now the government has also said कि lockdown खुल के आप अपना इंतजाम करें. I go to the people, they are crying like anything. खाना नहीं है, पानी नहीं है, बच्चों के लिए दवाई नहीं है. They are crying. If I start telling the tales, you will start crying, and even I will start crying. That is the real picture I've seen in last 70, 75 days, and which gave me a strength. Thank God, still we have something we can ultimately give to somebody to share it with. That was Guru Nanak formula, share Ravandike Shako. I think that he thought 550 years back, what today you and me are doing here in this society.
I think we all have a lot to be thankful for. We are truly blessed to be able to do some of this stuff. Justice Sikri, let me ask you a slightly different angle now. For a long time, we have all said India has a massive backlog of cases in our system. And one of the complaints that we had against the judiciary was that it's not modernizing quickly enough. It is not digitizing fast enough. It is not using artificial intelligence, machine learning, as many other countries have started to do. And Indian technologists are known worldwide. Do you think this is an occasion? Because already cases are being heard now remotely on video, etc. They're also being decided on remote hearings, which is actually a wonderful development. So justice has not stopped despite this absolutely amazing crisis that we are seeing. Do you think this will give a big push to our digital move in the entire judicial system, or maybe the criminal justice system, the entire system itself?
Right, and Justice Sikri, also adding on to what Mr. Munjal is saying, are virtual courtrooms then here to stay for the long run? And also, how challenging has it been for judges and people within the courtroom to really embrace technology very quickly and adopt it very quickly on a daily basis?
So, yeah, I'll come to again, like last time, this question specifically, but before that, I'm really moved by what is said by Mr. Singh and even Mr. Gupta. I always say, as far as police is concerned, it is given a golden opportunity to show its human face, which it is showing, no doubt about it. And what Gurdwara committees are doing, that is phenomenal. That is, I think, unprecedented in the history anywhere in the world. There's no doubt about it. And when I see the judiciary from that prism, from that lens, and the question you put me last time also, last question was that when the executive fails, I feel that here there's a difference between the attitude of a judge or judiciary and the government or the executive. Because the what was said by Mr. Singh was that about the mercy, compassion, sympathy, empathy. All these are the attributes of a good judge, which the judge has to, particularly while doing social justice. And therefore, I would say the judiciary, if they are listening today, and I will tell the judges whenever I get a chance, please learn from what kind of approach, which a humanitarian approach, which Sikhism adopt. And that has to be adopted in the justice making system. That is, I was prompted to say that after hearing such kind of tales from him. But coming specifically to your question and what Mr. Munjal has also said, I say that certainly it is a golden opportunity. It is an opportunity for the judiciary to revamp itself, and make use of technology as much as possible to modernize the judicial system. I tell you, there has been computerization for last 15 years. That project has been going on. But up to now, we were in this mode of automation only. Now, this has given us a chance from automation to transformation. And it is happening. Good thing is that the Supreme Court has realized, other stakeholders have realized, and it has started happening. Because as you know, justice delivery.
And will it, do you think it will happen all the way down in the entire system, not just the Supreme Court, which will go all the way down to the...
It has gone down. That's what I'm coming to. Supreme Court passed the directions in the beginning itself, how the virtual hearing or through video conferencing the hearing should take place. Of course, what was happening earlier was, as I said, that technology was used, and it was paperless courts, or we tried to have that, and online filing of the court fee, the payments, etc., filing of the pleadings, etc. But then as far as facilities of video conferencing or virtual hearing was concerned, that was not taken to this level, except, as I know, in Delhi, for the last 10 years it has been going on, when these persons who are under trials, they have to come to the court every time and now and then for their remand cases. But that is now happening on, for last 10 years, as I said, on video conferencing, and therefore they don't have to physically come. But now we have realized that, look, there are certain circumstances in which the virtual hearing would take place. Now, today, we are in a COVID-19 situation where physical hearing is not possible. But at the same time, realization has come as to what are the other benefits, if I may say so, very hurriedly that I mean it is a cost saving. It leads to saving of time, unnecessary travel, etc. And there's more transparency in the entire system because of this, when it is video conferencing and live streaming as also is there. So in so many ways, this technology and coupled with the aid of artificial intelligence, now this is at one place. Now it has given rise to very another important transformation, if I say, which we call ODR, that is on this online dispute resolution. There are many types of cases which can be taken up online and can be decided. So we have been categorizing those cases. There are particularly small types of cases, etc. And coupled with, we call it mediation, but pre-litigation mediation. Even before going to the court, you try to resolve these cases through mediation and online. So all this is going on, and what I feel is that even when we return to normal times, and tomorrow, after a few months or maybe 1 year, I mean, maybe it should be within few months, that physical hearing is possible, but this hybrid system should continue. We can't dispense with the physical hearing for so many reasons. But the cases which can be decided through virtual hearing, and there are lots of them, as I said, which categorization has been done. And we have started taking the now help of this technology. This should stay, and wherever this is possible, it should be on virtual hearing, which will lead to court management, case management, tackling of arrears, etc. And wherever physical hearing is required, it should go. I mean, we should go with that physical hearing. So this hybrid system should continue, and if we have now studied. And I was, that Niti Aayog has had organized one such webinar. Rather, it was a closed door meeting where the judges, sitting judges of Supreme Court were there. I was there, and the other stakeholders from industry were there. Those who are running ODRs, etc., were there. There were government people. In this closed meeting, exactly this is what is discussed. And I hope if Niti Aayog takes it forward, and if the cooperation of all, judiciary as well as the government, it can go a long way in tackling the area.
Yes.
Indeed, sir. And in fact, the hybrid model or the blended model is something that every sector is really looking at, whether it's healthcare, whether it's education, and any other critical sector. Let me come back to you, Dr. Trehan. When Mr. Munjal introduced you right at the beginning of the show, he said that you're a doctor as well as an administrator par excellence. So I'm going to throw an administrative side question to you. How tough has it been for hospital authorities and administrations across the country in different states to really keep pace with the whole changing diktats and regulations that have been coming their way from different state governments, particularly in smaller towns where, you know, private hospitals are few and far between, and you know, one or two reputed hospitals, and those also have very limited bandwidth and very limited staff.
And would you also clarify on the accusation that is being made of many hospitals, especially private ones, of looking at this as an opportunity for a profiteering? Could you please clarify on that as well?
Yeah, okay. So I'm glad these questions came up, because there has been a major burden, you can say, or a new normal for hospitals now, where you take the tertiary care hospitals. Suddenly we stopped doing all elective procedures, and COVID was not really happening. So our whole revenue models went down to 20% revenue with a very high fixed cost. So that financial burden, if the larger hospital fell, you can multiply it for the smaller hospitals as we went down into smaller towns and even at the, not a village, but I mean district levels and stuff. So the point really is that on one hand, there was the revenue got lost. The other, we were all getting ready, bracing ourselves for this war that was about to come. So in that gap, a lot of damage has been done to many hospitals, many nursing homes. They have to close down and stuff like that. So, but the point now is that we are now in a state where we are seeing the upswing in the numbers. We know that things are not going to be good from anybody's point of view for the next 2 to 3 months, maybe longer. And the challenges will only become more. So what happened? We also have a new normal. that if we used to see patients about 100, and Medanta we used to do 100 video conferencings a day between all our specialties, we are doing 500 and more. So the new norm is already set for us also, that people don't have to travel for a consult with a doctor. And we also have been saying that 50% of the patients, when the digital age is really complete, will not have to be touched. You can do remote sensing, you can do remote diagnostic, everything is enabling technologies, but they're being developed. Now, that's the silver lining, that all that what took 5 to 10 years to develop has been compressed in a matter of weeks and months. And you see the new startups, the kind of technology they've come up with. It's heartwarming that human ingenuity has gone to work in this crisis. So I think that there will be many, many new things that happen. Many consolidations will take place because we're all taking loans now to survive. And if it is a much longer battle, many people will go under, and then we'll see how we make them survive. But right now, the government, not much help came from the government, or in fact, no help came, except we are requesting, please pay the outstanding bills from the government and from PSUs and all that to give some oxygen to this distressed sector. And we are supposed to be the front line. So there is that whole battle going on within us, and saying, how do we survive and go to the next world? So let's see what happens. Technology is playing a huge role. Morale of the doctors is still very high. They are kind of determined to work. There are some hot reports saying the doctors are trying to come.
Right.
That should not happen at all. Whereas Mr. Munjal's question about taking over private hospitals so this is actually a war for all of us. The public, the healthcare givers, the police, all of us. There's no hesitation. Wherever we need to participate, we must participate. So if the government has to force certain things on hospitals which are unwilling otherwise, like there are many, many people who have created hospitals. An unprecedented thing happened in Gurugram. In Gurugram, Medanta, Fortis and Artemis have got together and opened a hospital for public good, where we are all giving our services, our nurses, our doctors, our supplies, free to Meteor Hospital, which was already existing there and had some capacity. We are doing all that. And there are many people who have done it. But there are some areas where there has been some stress, where people have been fighting the government that we don't want to take COVID patients or we don't want to be taken over. I think that's not right. We should all participate, and when to end it with the profiteering business, it's criminal to do that at this time. In my opinion, in my view, there are no two ways about it. But keeping in mind that there is an actual cost of delivery, that cost must be recognized, like the government did for private blood testing for COVID tests, that they estimated that the cost of ingredients is 3,500. There will be 500 rupees required for the manpower and all that. And there should be a margin of 500 to renew all the other stuff, which was fair. So it came up to 4,500, with due diligence on every aspect.
Right.
Similar thing has to be decided on, and some of it has come out already. But everybody must follow the rules set by the government. So we are saying anybody who cannot pay doesn't have to pay. If there's a government scheme for them, that's reimbursed them. People who are insured, you accept the insurance. People who have the money to pay, don't have insurance, let them pay. This way, you'll be able to make us survive and take care of the poor and the rich with the same standard. That's our whole ambition, is not to discriminate in a rich man's or poor man's life at this point.
Right.
And I can also only echo the heart-wrenching stories that Sirsaji talked about, Justice Sikri talked about. When you see these little kids walking in the heat, dead sunshine, to be walking along with their parents and being, you can't imagine what misery they're going through. So, but, society has done a huge job. Justice Sikri knows a bunch of young lawyers from Bangalore Law School graduates got together and created this, the flights for labor stuck in Mumbai, to their different states, and then that has viral, and then lawyers have come in, students have come in, different social groups have come in, industry has come in to try to get these people home who are desperately trying to meet with their families and get out of the misery. So I think India has performed well in this whole thing. What will happen as we go down the stream, where so many people will be economically disadvantaged, would have lost their job, and they realize there is nothing for them economically? That is the big challenge. What will happen to the law and order?
So I think it's important to acknowledge, and Naresh, that's a good point you're making. I think it's important to acknowledge the role played by every part of the system. The government has played a wonderful part. The administration has, and which was the idea of looking at this as a 360 degrees, how everybody's input has helped. Of course, many people have complained. Of course, there are some shortcomings. Of course, we've not been able to do everything that we should have, but we are not equipped to do everything. And this was not something that anyone was prepared for. We heard amazing stories that there was a trend for a while that in anybody's home where there was a pregnant woman ready to deliver, they were not calling the hospitals, they were calling the police. And the police was escorting them to hospitals, not one. There were multiple stories of this nature.
Right.
So, Dinkar, tell us, how did the police adapt themselves so quickly to do things that they've never been designed or trained to do? And there were many other stories of this nature that we heard.
Can you unmute yourself, please?
You're on mute. Please unmute yourself.
Yeah, sorry about that. When this started, I realized early on that, crime is going to drop, and with everyone under curfew, and there's not going to be any, crime. So we quickly seized on the opportunity. We launched a major social service blitzkrieg. We thought it was a great opportunity, in which we could generate a lot of goodwill. We could do a lot of good work. We are in uniform. That gives us an inherent advantage over the other people and the civil administration at large. They take a longer time to roll out. While we can roll out, we are a disciplined force. So we kind of built on those kind of strengths which we had, and immediately rolled out. We had to establish delivery chains for home delivery of food, because in Punjab, all shops were shut and we had to deliver everything, whether it was food, essential goods, medicines, everything was kind of shut. So we quickly, adapted ourselves. It was a change in role, and we started a police chiefs group in which when he activated the whole thing, it was there earlier, and I would talk to them. We had video conferences. I actually addressed a video conference in the middle of this, about 700, I have about 400 plus police stations across the state, and I had all my subdivisional DYSPs and SHOs. I had about 700 people. We sent the message out. We use the social media, we use TikTok, to create awareness. We kind of appeal to the people. We encourage them to make such kind of videos, interesting, fun kind of videos, etc. And so all that was done, and then we started this campaign, when this unfortunate incident happened on 12th of April, when the hand of one of our assistant sub-inspectors of police, we were enforcing social distancing, the curfew at the Sabzi Mandi. This was happening in all cities of Punjab, and his hand was chopped off by a band of, guys who came to the Mandi in Patiala. And so immediately, in fact, we kind of brought him to PGI in Chandigarh. And again, it was a great example, as Sunil has been.
Right, I think we're having a bit of a technical glitch.
Cooperation of people work 8-hour surgery, and by the end of the day, his hand was sutured and all that. We united the entire police force. We built a campaign on this. So, which empowered the constabulary, the constabulary, which is about 80% of my force, about 60,000 of my cops among 80,000 Punjab police force are constables. In fact, that inspired that story, that campaign. It created awareness amongst the people that don't take on, don't fight, don't insult or humiliate frontline workers, whether it was doctors, paramedics going out for contact tracing, surveillance, house to house surveys and all that. So we had to use these kind of methods. We did crowdsourcing of ideas from, so it was a very democratic kind of, we flattened the hierarchy, we broke barriers, etc. And, got these ideas from the field, from everyone. And so people went out, they distributed sanitary pads to women, the cops, folic acid tablets. You spoke about, Sunil spoke about pregnant ladies in Moga district. Our cops around 11:30 at night, there was a lady, she was turned back from a hospital. Many hospitals were closed anyway, and they helped her deliver on, on the road itself.
On the road, yes, I heard that story, and brilliant, Dinkar. Some of those examples that you've given us are truly benchmarks that the police force of Punjab has set for the rest of the nation. We're running out of time here, so I'm going to give each one of you 30 seconds just to wrap up and tell me what is that single biggest positive that has emerged out of this pandemic for you that you think should be carried forward into the new normal, as we are calling it. Mr. Sirsa, 30 seconds to you first.
I would say two things. First, इस pandemic ने हमें सबको अपनी औकात दिखा दी. कुछ नहीं है, सब कुछ यहीं रहने वाला है, और इस दर्द ने has given a lot to us. And a single example, I must tell you, one small Kirtaniya donated his 1 month salary for langar there, and it really touched me. That एक छोटा सा आदमी जिसकी 20,000 सैलरी है, वो कह रहा है मेरी 1 महीने की सैलरी ले लो. Another person coming out and keeping his home pledged, कह रहा है मैंने अपना घर प्लेज करना है और मैंने मशीन भेजनी है आपको, मैंने अपने घर के कागज नहीं रखे, कल तक मुझे पैसे मिल जाएंगे, इन गरीबों के लिए मुझे खाना बनाने की मशीन भेजनी है. So this has given a lot to us, and when it has given a pain to us, agony to us, and it has given strength to us that yes, there is still a humanity, and there is no Dr. Tahir today, no Sunil Manjal as MD today. Everybody is a simple human being with simple life, and everybody wants to come out and help each other. That is the thing which we have seen in last 70 days.
Indeed, a big heart is definitely key to coming out of this pandemic safely. Justice Sikri, your final word.
Yeah, what I say is that, look, all that has been discussed, insofar as judiciary is concerned, because I'm speaking on behalf of judiciary, it is now judiciary also needs, of course it has shown earlier as well, but more humane face, and the sense of justice itself now should be seen from a different prism, different lens. That is one thing. And secondly, as we have already discussed, that this has also given an opportunity to bring judicial reforms in a big way, which is happening, and I hope that it is carried out even after this. And the third thing, that you have brought today all different stakeholders today, and to deal with such a pandemic, it is the cooperation of all stakeholders which is required, and all should set down and should proceed in a positive manner, and not to plug the loopholes of one or the other branch, but in a cooperative manner. If we tackle or try to tackle, then I think we can overcome.
Compassion and collaboration, clearly the two big C's. Dr. Trehan, what will you add to that? Your 30 seconds.
So, Tom Friedman has put it quite well. He said, this is a war between Mother Nature and Father Greed. This has set a reset button for us to really examine our life and say, where were we going? We were all rushing in the same direction. Where? Nobody knows the answer. So you go back to Alexander's example when he was embalmed, he said, leave my hands out of the coffin. Just to tell the world that I came empty-handed and I'm going empty-handed.
Absolutely.
So basically, if we re-evaluate our values, preserve nature, we have not smelled this kind of air in 20 years in Delhi.
Yes, yes.
You look at the sky at night. If we were going to leave a disaster for our children and grandchildren, this is the time to rethink the whole thing and say, where are we going? Everybody said the same thing in a different message, but ultimately back down to basics and reevaluate our whole system and see where we are going.
Right, back to basics. And DGP Gupta, final word to you.
I just want to say that, this pandemic, very unfortunate thing, but it gave the police of the whole country opportunity for an image makeover. And I think the police forces all over the country, all across the states, they have embraced this opportunity and done great work. And I feel that this has also empowered the people at the lower ranks and put them on some kind of a virtuous cycle where they do good work, they are appreciated, their good work is recognized, it reinforces their belief to carry on with this good work. And if you keep pillaring somebody, if you say that is a problem child, police is a problem child, they don't do any good, everybody kind of,
It's actually been a fantastic opportunity for an image takeover for the police forces of different states. Absolutely well said. I'm sorry, I'm completely timed out. Mr. Munjal, quick few seconds to you. Your big positive from the pandemic. You're on mute, sir.
Unmute.
Unmute yourself, Mr. Munjal.
Let me just say that leadership is about demonstrating and doing the right things. It's about humanity and about humility. If you can combine all of these three, and leadership is not just leadership of the country or the company, it's leadership at every level, including in our homes, in our families, as individuals, as friendships. That is what true leadership is about. I think that's a lesson we are all learning. And it's an ongoing lesson. We need to continue to focus on this. And more importantly, we need to practice it.
Right. Thank you very much, gentlemen, for your absolutely valuable insights and experiences. Stay safe as we gear up for the rest of the battle against COVID-19. Mindmine Mondays will be back next week. Thanks for joining us. Goodbye.
Thanks.